two outstanding guest speakers. We have with us Dr. Marcus Christopher Griffith, who I will introduce in more depth shortly. And we have Dr. Napoleon Higgins. We are going to review our data as we normally do. And I want to welcome my co-moderator, Dr. Ivan Walks. Our founder, Dr. Randall Maxey, is in the air and may or may not join us later, depending on whether or not he lands in time. But without further ado, Simon, if you will pull up our data slides, I would be very grateful. As is our custom, I have pulled these statistics from the CDC COVID tracker on the CDC website. This data is current as of the 4th of February. It was posted yesterday. We have a total number of cases. If you're wondering why I look so weird, technology is just really giving me a run for my money today. It's flipping my lines. But the total number of cases of COVID since the beginning of this pandemic has reached the unfortunate number of 76,246,964 with with new cases reported as of Friday, 289,747. Total deaths since the beginning of the pandemic have reached, according to our data source on Friday, 898,216, but it has been reported that it has now passed 900,000 since the beginning. Of all of the cases that we have seen, 12.5% were attributed to African Americans. And of all the deaths that have been reported, 13.7% have been attributed to African Americans. The daily death total as of Friday, or for Friday, was reported as 3,295. Next slide, please. Looking at the vaccination scene, as of Friday, 212.7 million people are now fully vaccinated. That does not mean that they have had their booster. And as you are aware, there is there's definite conversation among the experts about how this should really be described. Anyone who has not had a booster at this point really should not be considered as being fully vaccinated. But of the fully vaccinated as defined by the CDC at this point, which is completion of the initial series, 9.9% of that number are reported to be African Americans. They still are not providing the total number of boosted individuals by race and ethnicity beyond the 65 and higher age group. So all I can say is that for the US population that have received the booster, they are now at 89.6 million or 42.1%. And as we all recall, as we have been taught by Dr. Despanier, that it is when we have gotten to that fully vaccinated state that we will have the opportunity to decrease what we're all going through in terms of the pandemic, and then can start talking about endemic and how we're going to live with COVID going forward. Now, as an introduction to our program today, I'd like to show you the next slide. There have been several reports made. The Surgeon General has issued a report. The American Academy of Pediatrics has issued reports. Several areas of the Department of Health and Human Services, and I'm sure there's some other reports that I missed, all looking at what's happening with the mental health of our children since COVID has been our way of life. And this was published in September. I don't know that the numbers are significantly different now. This was produced by the Office of I never knew there were so many different offices in HHS, the Assistant Secretary for Planning and Evaluation in HHS. And I found this just overwhelming. Just to quickly enable you to appreciate what's going on, the green bar are 0 to 5-year-olds, the blue bar are 6 to 11-year-olds, and the yellow bar are 12 to 17-year-olds. So for each of these different categories of mental health diagnosis, they have provided a bar graph showing the prevalence in that age group. And attention deficit hyperactive disorder, something that has been a major issue in the pediatric world for years, has just blown up as a result of COVID. Now, the question, and I'm sure our experts will address this, is COVID exacerbating? Is it bringing out or making it more obvious that the condition exists in the child, or is there something else going on with this explosion in ADHD? Anxiety is a little easier to understand because all of us are anxious. As you see, the age group that seems to be suffering the worst from anxiety are our adolescents. That is also not necessarily unexpected if you understand the developmental stages that the adolescents are going through. Depression, again, is being expressed much more in the adolescents. Behavior conduct disorders, interestingly, are showing up in the younger kids, 0 to 5. Adjustment disorder, which I'm not exactly sure what it is, maybe one of our psychiatrists can break that down for all of us, seems to be pretty evenly distributed. Mood disorder is again being expressed much more so in the adolescents than the younger kids. Acute stress disorder is affecting the younger kids much more than it seems to be affecting the older kids. But the flip is true for PTSD, which is post-stress disorder, post-traumatic stress disorder. That again seems to be afflicting the adolescents more, and more or less equally of the other garbage can category of other mental health conditions. So with that tease, and I hope that does tease you a bit, it is my pleasure today to...
Dr. Neighbor-Stevens, can I just interrupt for a second? I just want to make sure that I'm clear on exactly what we're seeing. You know, sometimes I'm a little bit slow, so I just want to be sure that we're clear. So after a young person has COVID-19, the prevalence of seeing these things in those young people is what we're looking at. So just to go back to the top again, with respect to anxiety, after a young person has anxiety, we expect nearly half of the adolescents to have some sort of an anxiety diagnosis or some incidence of anxiety.
That is what they are reporting, yes.
Okay, I just wanted to be clear. Thank you.
And the methodology of this was more survey than looking at medical records. So that might make some difference. All right. Let me begin with the introductions of our guest speakers today. Our first, well, we're actually having a roundtable. And so to say that our first speaker is not really correct, but our first guest that's participating in our roundtable is Dr. Marcus Chris Griffith, who specializes in psychiatry and obesity medicine. He is a diplomat of the American Board of Psychiatry and Neurology and the American Board of Obesity Medicine. And he is working in Atlanta at the Southeastern Permanente Medical Group. And he's a clinical, I don't want to cheat him, he's a clinical assistant professor at Morehouse. But what I want to really emphasize, because he is engaged in some of the same stuff that many of us are trying to do in terms of developing our youth, he and his wife completed a book entitled The Tale of Two Athletes, The Story of Jumper and Thumper, which is a true inspirational story based upon a lifelong friendship that was turned into a children's book to combat the obesity epidemic. And the other thing that he is involved in, among other things, is that he has helped to create a minority health professionals mentoring program through a collaborative effort at Kaiser Permanente. And I wanted to highlight I won't say extracurricular activities, but the breadth of ways that he has found to help our youth. The next participant in our roundtable is a repeat visitor. I looked it up, almost exactly a year ago. I don't know if you realize that, Dr. Higgins. I'm speaking of Dr. Napoleon B. Higgins, a psychiatrist in the Houston Clear Lake area. He is the owner and CEO of Bay Point Behavioral Health Services and Southeast Houston Research Group. He also practices as a medical director of Hold My Hand Residential Treatment Center and a staff psychiatrist at Prairie View A&M University in the Student Services Center. He specializes in treating mental health disorders through medication management, psychotherapy, and behavior training. I am very happy to have both of these distinguished psychiatrists with us today, along with our resident psychiatrist, Dr. Ivan Walks. And I am going to ask that we begin with Dr. Griffith, who has provided a background on which we will launch our discussion. So without further ado, I present Dr. Griffith.
Well, good afternoon, and thank you for that most gracious introduction, Dr. Brett Stevens. And just want to thank everyone for participating today. It's always an honor to, share a microphone with my friend and brother, Dr. Higgins. Thanks, Dr. Maxey, Simon, Dr. Bailey, Dr. Walks, for helping to put this together. And it's, as you know, for all of us, this has been a very, very challenging past 2 years. And as part of answering that challenge, I'd be remiss if I didn't thank God
Amen.
For all that he has done for us, all that he continues to do, for allowing the breath in our mouths to have this word to come forward, to keep us safe, to keep us protected, and give us an opportunity today that all it takes is one split second to do God's work, and his will is done. And so it's our hope that the message that we carry forward today helps to enlighten and uplift those that are struggling with these very, very challenging times. And so Dr. Brett Stevens, listed these various psychiatric conditions of ADHD, PTSD, anxiety disorder, adjustment disorders, and so forth. We were already, even before this thing happened, in a mental health crisis. So in 2010, the American Psychiatric Association did a census of physicians, and it came out to be there are somewhere like 60,000 psychiatrists in the United States. of which only around 5,000 are African Americans. And of course, we all know where those African American psychiatrists are. Dr. Higgins in Houston, I'm in Atlanta. So Atlanta, Chicago, Detroit, LA, that's where they all are. And so outside of there, it's even a greater challenge. It is even a great challenge within our communities for someone to see us based on access, lack of access to coverage, insurance, stereotype and stigma. All those things have made it very difficult. But as we only have a limited amount of time today, I want to make this real talk so we can really understand what's happening now and what's made this an even greater crisis. So Simon, if you could put this first slide up for us, for everyone to see, I think it will help to kind of show what this is. How did we get to this point today? Go on to the next one. Right there. January 26, 2002, about 12 noon. So you think about this moment. Right before that, kind of everything seemed like it was fine. They had announced that there was this virus on its way, but we weren't really too worried about that. But just like that thing with JFK, we can all remember exactly where we were, what we were doing when this tragedy happened. And that's the thing that I think where it all started. With the death of Kobe and Gianna, is that there was such an outpouring of grief and loss. We all felt it. We all wanted to do something about it. We all felt like we knew Kobe. That was point one. Then, next slide. The tsunami hit. So Kobe and Gianna, it was almost like that's when the earthquake hit. And then afterward, there was this ripple effect. Perfect storm. This virus hits the scene. And we're all doctors here. We've been to med school, residency training, but in all of our training, we were never prepared or heard of anything like this, where this dreadful virus that, you shake somebody's hand, you hug somebody, the next moment you got a cough, then you're on a ventilator, and then you're gone. As we know, this virus has been affecting our people disproportionately. More likely to get it, more likely to have complications, not also able to have some of those fail-safe protections because many of us have been frontline workers, live in multi-generational households. We had greater exposure to more complications. If that wasn't enough, and then social injustice. We know we've been assaulted and attacked as people for 400 years through all the crimes and sins of slavery. But then what happened when it's George Floyd, it's Ahmaud Arbery, it's Breonna Taylor, it's so many people that's caught on film right in front of us that it was just more than we can handle. So Kobe, a virus, social injustice, dissent in the streets, and then what makes it even worse, there's an insurrection at the Capitol. Our voting rights are being taken away. And these people who are criminals are then being uplifted like they're not doing anything wrong. So it's hard enough for us to get our hands around this, but just think about what this is like for our children. If we don't understand, then how can we expect them to understand? And so that's kind of my take on what caused this whole thing to cycle and spiral out of control. And then, after I'm sure Dr. Higgins has his insight on this, then we can talk together about what can we do today to make a difference and change the trajectory of this problem.
Thank you so much, Dr. Griffith. It's always good to see you, brother. And also, it's odd not seeing you. You know, we've spoken over the phone, we've texted, but normally we would have seen each other at NMA or APA event, or something, or just being in town to hang out. So if you think about how we haven't seen each other, you have to think about also the impact on children and a developing mind, and them not seeing one another, and the losses that they have had. As stated, I'm sitting there we looked at the build up to the last election, and I'm looking at a kid inside the home, my own kid, with what the rhetoric that we're hearing. And I remember my father, who was 83 years of age, born in the 1930s in rural Texas, says that I've been alive for a long time, but I've never seen race this critical my entire life. And I grew up in the backwoods around white folk, but I've never seen this level of anger and aggression from the races towards one another, and unpredictability that we've seen. So you have the kids under those pressure cookers, insurrection, the loss of Kobe, not to mention also Nipsey Hussle right before that. And then I remember the impact and how it hit in my home and my family, where essentially, I know for us, we were about to head to France. All right. We canceled 2 days before the flight because they had shut down several things in France. We go to spring break thinking that we would be back in school after spring break. And for children, school is now over. Now imagine this. You go to school every day. That is your primary job. That's what you've been doing since second, third grade, since first or second, 1 or 2 years of age, where you've been going to daycare. And all of a sudden you go to spring break and you don't go back to school. So what you've known as life has now been taken away. And oddly enough, for her, it was her junior year in high school. There were kids that she grew up with that she just never saw again, because school was out for the rest of that year. And for a lot of kids, it's been out for a year and a half. Now for her, she stayed home for the first half of her senior year and went back to second half, because honestly, she said the stress of not interacting with people and looking at the camera, realizing her mom and dad are busy working, that was too much, and the too much on the mind. So we have a generation of children who have had life to switch, to change on all of a sudden, where you could not go back to your normal. And even right now, we look at, even though I guess there's some normalcy, this is not normal. And the question is, will normal ever come back? So what we have to look at during these ages, when children have identity development of who they are. I'm the smart kid. I'm the athletic kid. I'm the kid who does X. I'm good at art. I'm good at music. I'm good at being a great studious, obedient kid. Or I may be even the kid who's funny and acts up in the classroom. But the fact is that the loss of identity has been huge for these children. And then we're looking at how do we repair that back. So when we look at adults, at least we're in command of what we do that day. We can, either decide to go to work or not go to work. We can decide to wear a mask or not wear a mask. We can decide on precautions or not on precautions. But kids, I tell people, are like rubber duckies in the room, that, like they're rubber duckies in the tub. So the water is splashing around, but the rubber ducky is not in control of what is going on. And they just kind of floating and bobbing and banging into the wall of the bathtub. Well, the thing is that because they can't control their environment, whatever adults do directly impacts what they're able to do. So imagine being in the midst of COVID, but you don't have the control. You have to count on those around you to have control. But we're looking at the rhetoric that's being said on television with politics. We're looking at the insurrection. We lose Kobe. We start the pandemic. We lose our friends. We lose school. And now what do? So this sense of loss is what we're looking at, and the issue of grieving on multiple levels. And then I remember, I want to tell you when I knew when this was big. In Houston, they canceled the livestock show and rodeo. The livestock show and rodeo is Houston's three-week big event that is if the Super Bowl doesn't show up, this is the biggest event, the biggest money maker in Houston. When they canceled it on its second day, and I knew that the city was going to lose hundreds of millions of dollars. But then that next weekend, because rodeo follows Mardi Gras, the phone started blowing up from my friends who live in Louisiana, because we're right here next to the border, about all these people who died. And the connection was that all of these people went to the Zulu Ball for Mardi Gras. And so there was a lot of anger in the community on, now how are they going to cancel the rodeo, but not cancel Mardi Gras? And we've got all these Black people dying who went to Mardi Gras. All right. So now on top of that, now you're starting to see people pass away, lose their family members, and sadly, then they started, because at one time, you remember how they had the misinformation that it didn't impact the Black community. Y'all remember that story? And I can tell you that me and my friends knew that when they said it was greatly impacting the Black community than other communities, that means that the nation was about to open up again. So even though we see the numbers where the Black numbers have come down, we're still leading the world as a nation, with this being the third largest Black African diaspora country. All right. So even though our numbers are near what the nation are, they're still way too high. And we need to be able to make sure that we focus on what we could do better. Now, if you look behind me, this book right here, Bree's Journey to Joy, a story about grief and depression, is written during the COVID era. So if you look at the book, and it's available on Amazon, she has on a white coat and goggles, and then on other pictures, she actually has on a mask. We wrote this book. It was supposed to come out in April of 2020, but the pandemic held it up. Oddly enough, we had to add the pandemic to the book because we had written a book about childhood grief and depression already. So the book was already done, ready to be published. We actually had to hold off the publication, thinking that we would introduce the book instead of the spring, maybe the summer, then the summer became the fall, and then COVID kept growing. And we were still in the alpha variant at that point. So then we had to put COVID inside the book. And the story is about a young lady who loses her grandmother, but we add COVID to the actual story. But the fact is that children have grief and loss throughout their entire lives. But so often as adults, we look at what's going on with us, and we don't pay attention to what's going on with our children because they're suffering the same losses without the maturity, without the understanding, and without the brain development, and this greatly impacts them. So all of us probably can remember when we lost our grandparent. That was my first significant loss. Honestly, outside of crying when I was a small kid because I cut my arm or something while riding my bike, I don't remember crying until my grandmother passed away. And it was not something that I expected. I remember walking into the church, seeing sad people, and then I think the sudden understanding of finality of life all of a sudden hit. That the woman who helped raise me would never be around again. And so when we look at this pressure cooker, you're losing parents, and sadly, kids are losing friends. They've lost school, they've lost their community, they've lost issue of who identifies who they are as they grow up. And the losses are so impacted that now the sad thing is that now if you got COVID, now you have the fear of the loss of your own life and the finality of what that means. So these kids are experiencing some things that we've never seen before. And the fact is that I've heard people say that, the incorrect notion that what would kids know about life and what's going on? How could they make, I remember hearing a preacher, we were talking on Sunday, a preacher once saying, well, kids shouldn't sing adult songs because they don't know about life. The fact is that you don't know what that kid has been through. And many kids by the age of 9, 10 have been through things that you'll never see in your entire life. So we have to make sure we pay attention to our children inside of our home and support and help them grow and help them pull through this entire pandemic so that they're not as harmed mentally on the other side.
So Dr. Neighbor-Stephens, as the third wheel psychiatrist, let me just raise one thing. We oftentimes are able to look at the external factors that impact mental health in adults and in children. And today so far, we've heard excellent illustrations of how the things going on around kids impact them. I want to add something else to that, and then maybe have a couple of you pediatrician people jump in to help us expand the background a little bit. One of the things that has happened with young people as the pandemic has progressed impacts them a little bit differently. Many of them free and reduced lunch kids. They didn't have the same access to nutrition that they had before. And we know that physiologic impact of changing access to nutrition, either through losing access to food that you may get in school, or parents losing jobs, and so we can't feed you the same way we fed you before, that can impact a child's mental health, a child's resilience, all of the things that we've been talking about. So we've heard expertly about all of the external impacts, and I think through nutrition, some of the internal or physiologic impacts, not to mention kids being locked inside and can't get outside, and the vitamin D and whatever else happens when we don't get exposure to sunlight and all of that. So I wanted to just bring that into the conversation, Dr. Nabin-Stephens.
Thank you so much, Dr. Walks. We have several pediatricians on the line. Simon, if you could unmute Dr. Bean, maybe she can respond to some of what we have already heard, and then we can proceed, Dr. Walks, in going through some of the questions.
Well, thank you. I'm no different than any of the other pediatricians, I'm sure, in terms of our experiences. And I appreciate everything that has been said, and I really enjoy it. And also, it's very informed by it. And I'm hoping at some point we can get some of the discussions around into what we should be doing in terms of intervention. I'm going to point out a couple of things. One is, for example, the role, and which I think is extremely important. And it's only now that we're beginning to realize, some of us who know that the path to success for minority children has always been primarily through education. And at this point, I'm sure all of you know that most of our children who were already behind have lost up to 2 years of their education. Most of us realize that at least if you're a pediatrician, I had staff, for example, who had to bring their kids to work with them when school was out. And so I had the ability to observe not just patients, but what was the dynamics that we're having as you had children sitting trying to do virtual school. And I remember having conversations with them. How do you like it? I don't like it. Of actually walking in and seeing children who were supposedly doing virtual education, sitting there at the table while their parents worked and with their heads down on their arms, either sleeping or just frustrated. So one of my big concerns is is that issue that all of our children have lost so much in terms of education, and how do we compensate for that? The other one that's very disturbing, which I think is also very disturbing to children, adults have a tendency to assume that children do not listen. They hear everything you say, they hear everything, they watch everything you do, they have their own interpretation. But doesn't it bother people that they go to school boards and threaten to kill school board members because they have the nerve to discuss what you should be the best thing to do around the issues of schools, whether you should wear masks, whether you have vaccines, all of those controversies are whirling around, and the same anxieties. And I know that much of the frustration and anxiety of parents, but those are also being transmitted to children. They see that. How can you expect not to be anxious if we are at the stage, I remember the Trump era, still is, but where you couldn't hold a conversation about politics with your friends. You made it a point, never discuss politics with your friends, and you could probably mean the same thing when you're home and with your friends. Don't discuss politics because we may not be friends anymore. But at this particular point, how can they avoid it? But at the same time, it's become such a polarizing issue, and children are very involved in that, whether they know it or not. People are fighting about them. But at the same time, you're expecting the children not to respond to that. The other one is, and I'm looking forward to some comments from my colleagues around some of these issues, because I'm not giving you solutions. I'm pointing out some of the things that we are presently trying to address and that children are addressing. It was mentioned the increase in the incidence of ADHD. Well, one of the major problems with ADHD in terms of, and any other children, remember our children are disproportionately diagnosed as having learning disabilities, is the fact that they are not getting, we're taught normal children, children without learning disabilities, children who would normally be doing well in school, who are having difficulty, children with special needs, and in this case, simple problems like a learning disability, a little extra help, Johnny can't read, a little help, extra help with reading and that kind of thing. Those things we fought for years for, IEPs, getting extra help in the classroom, telling parents with children who are hyperactive, get them into a social situation so they can begin to learn how to be successful. Those things we're no longer able to do for children. So most of my comments have actually been to reinforce already been said, but I really would like to hear some potential solutions and some creativity about how we can approach some of these issues within our own context that we can actually do. Thank you.
So I wanted to emphasize that today's topic was not just about COVID. We said the mental health of our children impacted by today's world. And one of the things I want to make sure we include in our discussion this week, it doesn't take maybe a lot to set me off maybe, but I really got set off this week when I heard some of the comments made about the audacity of us having a Black woman be named to the Supreme Court. And some of the stuff that has been said about Black women in general and these women in particular. So if we could also keep that in mind as we go forward in our discussion. And I'll turn it back over to Dr. Walls.
So Dr. Neighbor-Stevens, that subject deserves an entire program for us to because to your point, and to not be at all flippant about it, to your point, I don't know that anyone impacts children of color more than the women in their lives. It's just a fact. And so absolutely, it's a huge thing. We did have, because we wanted to make sure we hit on a few things. I'm one of those people, I am interested in knowing the problem. I'm not big on celebrating the problem. I really do like to get to what are we going to do? What can we do? Because one of the feelings I hate the most is a feeling of helplessness. I like to know that there's something I can do, and then I want to get about the business of doing it. So we had several questions we wanted to make sure we got to. I think we've gotten to the question about how the last 2 years has impacted children. And so if there are any more comments about that, we're happy to get into those. I think one of the other questions we had was, well, why has this happened? The why has the world gotten the way it is? I don't know if we have enough hours to answer that question. I think we've gotten a little bit at the question of why has the impact on our children happened? Why has this happened to our children? That's one of the things we wanted to talk about. But let me get to, and again, anything that I skip past, I really want somebody to say, hey, hold on a minute. But the one I really wanted to get to is, what should parents, guardians, and caregivers, what should we be looking for? When, I've known Johnny, Lamont, Malcolm his whole life. I've known Susie her whole life. What should I be looking for to know that whatever's been going on these last couple of years, my child is different, my neighbor's child is different, and different enough for me to want to say something or do something? So what are the signs and symptoms?
Well, I put together some things that hopefully we can use that'll be really practical answers, practical solutions. So, the first thing is this, is that given what's happening right now, let's say you feel your child has some emotional problems, you need to get some help. You look on the back of your insurance card, you call to make an appointment. Good luck if you're able to get an appointment within 3 months. Let's say you have resources beyond your insurance and you pay cash. Good luck if you're able to get an appointment within 2 months. So let's talk about what you can do today for your child. So as we listen to this story that continues to play out, we have lost our ability to have resilience, okay? And you've heard this term of resilience, and resilience is basically that ability to recover from an event with physical, mental, and emotional wellness. Because you've had so many things, one after another, you're not able to regroup. You plummet into a deeper hole. So we've had a lot of this time right now where we're to ourselves watching TV. And I would have to say, I've been watching a lot of basketball. Karl Anthony Towns, a player for the Minnesota Timberwolves, is every man. He had 9 people in his family die from COVID. How many of us can tell that story? Not only COVID, but we're losing our family member from just regular stuff. Heart attack, stroke, cancer, gunfire, all those things continue to happen. So I put together a few things that perhaps we can do to help our children today. So Simon, if you could hit my slides again, I'll be very brief and cover some things real quickly. Hit slide number 5, okay? What we can do today to help our children. And I have this little mind, keep going down. One more. There we go. I call it LOL, laugh out loud. All right? I want to change the order. The first thing we do to help our children is to love them. You know, sometimes our children push back when you try to hug them. Don't let them push back. Hold them tight, kiss them, hug them, squeeze them, tickle them. Do some of that basic stuff with them. Spend that time with them. They may push back against it, but make sure that you give them that time. Give it to them. You're stuck at home, spend that time at home, loving them, hugging them. Next thing do is listen. Listen closely what they have to say. See who they're talking to. Observe them. Who are they texting? Who are they following on the internet? What kind of television shows are they doing? Pay really close attention so you know to love them, to uplift them, to give them exactly what they need to do to thrive in this environment. Next slide. Then we have this wheel of self-care that looks at the physical, the psychological, the emotional, the spiritual, the personal aspects that are happening, not only with COVID, but with just the emotional things that are happening in our child's lives. And then to be able to put together some pinpoint things that you can do to help them. Next one, right here. Use things that are going on to engage and embrace. So, healthy eating. Don't go to the fast food stuff. We know your nutrition is an important part of your emotional and physical wellness. Take time with your child, go to the grocery store, teach them how to cook. Get some vegetables, get some fruits. Maybe you get a community garden and you grow your own foods. There are a lot of nice parks around. Go outside, take a walk, start jogging. Get yourself a book that does identification of birds, insects, and plants. Play some games with your kids and see how many various types of moths that you can identify. Take a break from the news. Turn that thing off. It will drive you crazy. Use your imagination. Do some things in a way. So it's kind of that thing where, you know, you make, lemon meringue pie, lemonade, lemon tarts, whatever has been given out of that lemon. Next slide. And so how I practice what I've been preaching is this. Point one, get that shot. Because if you ain't alive, you can't do none of those things. Get the shot. And I describe the shot. It's not a force field. It's not Star Trek where they fire these things at you, boom, and you're protected. No, it's a bulletproof vest, meaning you still don't want to be shot at. Keep yourself away from them flying bullets. Wash your hands, wear your mask, keep yourself safe. But if you do happen to get shot, that bullet is coming at a lower velocity, less likely to do organ damage. Maybe the bullet bounces off of you. But those treatments that we have for COVID are not very good. Once you got it, it's not that good. So don't get it. Protect yourself. Listen to your doctor. Because when somebody gets sick, that internet is not going to help you. You'll be calling one of us to put that tube down your throat and turn that vent on. And unfortunately, because many of us have obesity is a greater risk factor for complications of COVID than anything else. You get in that vent, you're not going to get off. And finally, as I put this stuff, next slide, is I'm going to show some of the things about how I practice what I'm preaching. Going outside, fishing. I fish every day. Y'all people know me, I fish every day. Dr. Higgins knows at those meetings we with the NMA, I always had a fishing rod with me. I made my own garden outside. You can see some of the stuff I grew. Those things right there, that was from one afternoon. Get a puppy. There are lots of people who have been lost due to COVID, who've had animals that have gone to shelters. There are puppies that need love and help. It will help you, it'll help them. Try some other things. You see a little picture there? I took my hand at sketching and I went outside, I went up to a monastery and I drew a picture at the monastery. And finally went outside, work on your golf game. Our priest said there's 4 things that are going to happen during this time to somebody. You're going to become a monk, a chunk, a drunk, or a hunk. We know people have been drinking more during this time. Not good. Some people have been eating bad stuff. Other people have turned it in to get in better shape. But one of the most important things that we can do during this time and more challenging time is spend more time with the Lord. Pray, meditate, and teach your children how to pray. So those are just my points on what to do during this time.
If you don't mind, if I could share my screen here.
There we go.
All right, there we go. And so basically, just to look at the 13 steps to good mental health, and much of this Chris has already covered. But, the fact is that we've got to reiterate good health practices, wear a mask, physically distance. And one thing we need to make sure we understand is that we need to physically distance, but not socially distance. A lot of children are actually suffering from isolation while sitting at home and sitting in front of screens, all right? Because you're not getting input to your body, you're putting a person in isolation, and realize that isolation is actually a torture technique that they've used since the dawn of man, because we are a community of people that we have to live with one another. So essentially, if you cut one grape off the vine, then that grape starts to wither and die. So we need to make sure we physically distance, but not socially, and make sure you do the regular stuff that helps with living. Make sure the kids have a schedule every day, especially with the kids who are in and out of school. Whether your kid is in school or out of school, they need to have a schedule and a purpose and a list of accomplishments that they must do. Since being out of school, a lot of kids have thrown off completely their sleeping habits, when to go to bed, when not. And too often I'm finding kids who don't even bathe daily, especially if they're not going around other people. As Dr. Griffith stated, exercise is key. I would say this is one thing that I learned for myself, especially during the pandemic. getting outside to do some sort of physical movement, be it work in the yard or take a walk or ride my bike or doing something with your child, especially engaging your child. Good nutrition is going to be key because so often school is the one providing good nutrition. And I know in our communities, so many of us who do not understand nutrition. So essentially for lunch, when it's not in school, if we go get something to eat, I'm seeing, flaming hot Cheetos. All right. You had a Pop-Tart for breakfast, flaming hot Cheetos for lunch. And then because of dinner, we're going to have 2 bags of flaming hot Cheetos instead of 1. This is not good nutrition for the brain or the mind, and actually increases your risk of getting illness and getting COVID because your body's not adequately treated. Nutrition, careful about the news. Now, when it comes to these issues of insurrections and race, and the thing that they're questioning the merit of the woman to be nominated for Supreme Court justice without even knowing who the woman is. But by saying it's a Black woman, there's a question of the merit of the individual, even if you don't even know who it is. And it's going to be important for us to have very conscious, good conversations with our kids, because the thought is that if you don't tell your kid what's going on, then the world is going to tell your kid is what's going on. And you don't want the world speaking before you do. So it's important that you understand that kids can understand what's going on and they can see what's going on. And you've got to arm them with good information so they can understand that racism is real, sexism is real. And the problem isn't them, it's the issue of somebody else's mind. It's the other person's mind, because if you don't tell them, they'll believe what they're hearing on the news. So I would say in my home, there are no conversations that we will not have. Now, we may have to make it to where it's understandable for a person of a particular age, but the world is telling them, you need to tell them first yourself. So be careful of the news, be careful of that overload of bad news, because sometimes you need to take a break. Make sure the kids have a place to work. All right. I'm known for some families, especially in an impoverished homes, because the place is small and the kid is trying to get work done, people's schedules are changing and all of that, that the kid may not have a place to work and get their stuff done. Now, when it comes to online stuff, I'm not a person who says a kid can't get online. And the reason I say that, because you've lost the physical contact with individuals, you are able to contact people online. Now, you've got to monitor that. You've got to know what's on your child's phone, and you got to be able to look on that phone. All right. Let me see what's on this thing, because you got to be careful. But with oversight, that could be a good way for the child to connect. One of the biggest things you've got to do, and I got a freshman in college right here, and they're having their issues as well in colleges and in all schools, stay in contact with the school. If there's something that you don't have or you don't understand, or you're having difficulty getting in online, or the teacher was out, the school did, some information may have gotten dropped and not communicated. Plus you have the issue of kids not being in school. So you got kids going to the 3rd grade who've never been in school. So the rules of school, some kids don't want to be in school. Some kids don't even see the point in school because they did school 2 years without it. And so the issue becomes, we've got to make sure that they understand how important school is and stay connected. If you're going to need services, you have realized I'm the psychiatrist. It's hard to get in to see me and Chris Griffith. But the fact is that you possibly can get in to see your pediatrician before you can get in to see me. So before it's a problem, or if you notice there's a problem, you want to start right then. Talk to parents. All right. The parent, you need to stay in connection with your kid. Prayer and meditation is something that's going to be key. These last 2 are key. A lot of us don't know how to pray, and we definitely don't know how to meditate. So I tell people, prayer, like we make it, it's like sitting on Santa Claus' lap, giving him a list of what you want. All right. So I remember my daughter told me when she was 7 years old, she wanted a blue Mustang at 7. All right. Now, when she was 16, she got a grandmother's car who passed away. That's a loss. And she took care of the car, kept the car washed, didn't get into any wrecks, let us know where she was at and what she was going to do, graduates, full scholarship to college. Guess what showed up on the night after she came home from prom? Was the blue Mustang. Why is that? She showed and proved that she was able to do the work to take care of herself and that car. So what came is preparation. So the prayer is the request. Meditation is, what is the preparation that I need to do in order to get those things done? So you should spend more time meditating than you actually are in prayer, because that's the request. Teach your children how to meditate over what they want, and then adaptation. Things are fluid and changing, realizing that the world is going to be very different for your kids than it was for you. And the world, because of this upheaval, is like a deck of cards thrown into the air, they fall to the ground. So there's a mass reshuffling of everything that's going on. I'm like at the domino table or something. There's a mass reshuffle, and there's going to be a replay. The thing is that you want your children to be on the other side of the replay, ready to go, because they're in school training for jobs that don't even exist. That's why it's important that they have a sound education. And I'm gonna go with Chris's LOL. And funny, I had written down the same similar thing, which is make sure as an adult, turn off the phone, get off social media, stop living your best life and checking who's liked your pictures or not, and spend time with your child. All right? Turn off. Nobody ever dies, and I don't believe anybody's going to die and say, I wish I was a social media star. Nobody dies. No doctor dies and says, I wish I had done more call at the office and at the hospital. That is not going to happen in your life. All right? Unplug, tell them other people no. All right? Because realize our work schedule in America that's been spread around throughout the world is an issue based upon slavery. No matter how hard you work, they want more. And if you don't work hard and produce more, then you get punished. All right. That's a slave mentality. And trust me, them people at your job, if you died, we'll have another doctor in that seat or in that exam room the next day. And trust me, you are not that important to what they do. The second thing is spend the actual time with the kid, with your child. So unplug from over there, spend time with your child. But the way to know that something is wrong is if you see a change in your child's behavior. Something's off. Something's different. They're spending more time in their room. They seem more taken aback. They're more irritable. They're more argumentative. Things that they would normally do that were positive, they're not wanting to go to football practice or cheerleading practice, or not wanting to practice their horn, not going around the same friends. When you see that occurring, it's time to make sure that you pull even closer. And I can tell you this, if a parent tells you that they don't speak to their child and they don't have conversations, I can guarantee you that that parent does not eat with the kid. Because eating is a communal process where people talk. That's why business meetings and business deals are done over food, because it causes people to engage one another. You're sitting across from one another, you're enjoying food, you're enjoying water or a good drink or whatever you may be partaking of. And that causes people to communicate. So it's important that we unplug, leave the job, turn off the phone, and engage our children, especially in such a difficult time. And I hope that helped answer the question of what we can do. We gave you all about 20 things that you can do to help your child through these difficult times.
So Dr. Higgins, that excellent, extremely helpful, good practical advice. If you can turn your screen sharing off, that would be, though I hated to get away from those slides. You know, it's always nice when we have slides that have the pictures and we can look at them. And one of the things I wanted to comment on, not everyone who is on the call today is a physician. We have a lot of folks who are not physicians, and I appreciate you all giving us the information in a way that it is easily digestible. None of those $3 words that, you know, we all like to impress each other with. I really appreciate that. Can I, in that same vein, Dr. Neighbor-Stevens, I want to go back just a little bit. Even though I'm a physician and I got those nice initials after my name and oh, my family's so proud, there's a lot I don't know. And sometimes I don't know when it's time to be concerned. I'm talking to my child, I'm loving my child, I'm trying to make sure that they're eating healthy. But can you all give us a little bit about when is it time to be concerned? If my kid isn't sleeping the way they used to, if my kid isn't eating the way they used to, if they, you know, I used to hear them laughing a lot. They're not laughing now. Can you just hit some of those signs to let us know that things are different and things are going to be different, but things are different and I should pay attention?
Well, the fact is that these are things that, as you just stated, are things we need to do every day before something is wrong. All right. So spending the time, paying attention, doing things together as a family, eating together, having fun together, playing together, going outside together, exercising together. Because the fact is that when you think back to your childhood, things like graduation that everybody shows up to are not necessarily the most meaningful times or the interactions that I had with my parents. But the actual times is riding in the car, giving understanding, information, showing the love every day, waking up, hugging your kid, kissing your kid, pushing them on out the door, sending them a text, all of those things that we want to engage on a regular basis. But the fact is that when are we in trouble? One, when we've been in trouble. All right. When we have not been doing those things because the career was so important or the job was so important or my friends or whatever else I was doing in my life was so important that it was more important than my family. And that your kid has to know that they're number one. So giving that love on a regular basis. But then you see the change, realizing that all the love that you give your child does not mean that your child will not become depressed or anxious or have ADHD or sadly even commit suicide. All right. So when we're seeing that change in behavior where they're pulling back from you, they're pulling back from their friends, we're seeing where they're not engaging in things, that is when it's a mental health issue. Like the fact is this, nothing is a mental health diagnosis unless it impairs. Mm-hmm. All right. So if it's not impairing, it's not a mental health diagnosis. So far as like, say, for example, hypertension, that is a health diagnosis, whether you feel impaired or not. Right. But with mental health, it's when you're not able to, your grades are falling, you're not engaging, you're not able to do the things you were normally able to do. And the fact is that in mental health, you can hallucinate all day long, but it won't be schizophrenia until it becomes impairing in your ability to work and your well-being, not only how you're doing the day, but are you able to do well and move forward in life and grow? And when that child is not doing well and pulling back, and not able to engage in their current and not able to move forward is when the alarm bell should start going off. Because it's normally not that it was one incident that let you know. Mm-hmm. It's been a trail of incidents where, the grades are dropping, the friends are changing, at that point you start looking through the house, they live in your house. I understand. My thought is if it's my house, my rules, and that's my room, so now I got to go through your stuff. I got to look for some things. I got to check that phone to see what could be impairing you and impacting you to see that change in behavior. Now, when you start seeing a lot of crying, a lot of depression, talking about, I don't want to live anymore. I hate all of you all. And when you start hearing that, that means that they are letting you know very loudly. And I will tell you right now, the last thing you want it to be is that you did not do enough. When you hear that going on, I don't care what's going on at that job. Trust me, I know as a doc, it's more like that. Like I say, they'll replace you in that clinic. My thought is I'll replace that clinic itself and I'll be somewhere else. Right now, they're hiring a lot of different places. So don't be so attached to the job or your life or your friends, or whatever, that you're not paying attention to your kid, because you want to know that in case something bad occurs, I did all I need to do. I took my vaccine. I got my kids vaccinated. I socially distanced. I put on my mask. And I still got COVID and something bad happened, but I can say in my heart, I did everything I knew to do to protect. So when it comes to your child's mind, inaction is the worst thing that you could do. When you see the falling down, you want to go all in, even if they're trying to push back, because you want to know that you did all that you could do. And trust me, your kid knows when you're giving them that effort. Mm-hmm.
And to add to what Dr. Higgins has said, just beautiful, practical, passionate message, guided by his faith and his hard work. The other piece, of course, unlikely there are many children who are watching us now, listen to us. But this is also for you. You have to take care of yourself. Because if you are not taking care of yourself, if you yourself are struggling with depression, anxiety, drinking too much, not doing your routine exams like your breast exam, your colonoscopy, your prostate exam, you are going to have a bad health outcome. Then if you die, who's going to take care of your child? So you need to do those things also in taking care of you, because you got to take care of yourself to take care of them. One of the things that is very important that we have to do to take care of our children, their mental health, their emotional health and wellness is, if you have young children and you have not created a will, shame on you. Because if you don't have that will and you and your spouse die, that state of Georgia, that state of Texas is going to make decisions for your child. So you need to make sure you have everything spelled out to take care of them. And you know, you don't have to have a lawyer to make a quick will. It can be written on toilet paper. As long as you have that a witness and notarized, then that can be what is needed to take care of your child. So take care of yourself to also better take care of them.
And if I may add, Dr. Griffith, as you stated, the biggest impact that you have on your child is the child modeling after you. That is how the child does things is going to be based upon how the parents do things. So if you're drinking too much, you're clowning too much, you're not bothering to take off time from your job for them, then why should they take away time from what they're doing for you? All right. If you're not bothering to go and get your health checkups because the work is so important, and you got to think of how this looks. My job is more important than my health, which means that my job is more important than me, which obviously tells that child that your job is more important than them. We've got to make sure that we model the life that we want our child to come up in.
So Dr. Higgins, Dr. Griffith, I can't thank you all enough. And at this point, it would be nice if I would say thank you so much and we move on, but we can't move on yet. We got some more work for both of you to do. One of the challenges in our very diverse community is that sometimes we do have to go to work. Sometimes it is that paycheck that's coming in a couple of weeks that's going to keep food on the table. And so there is that struggle. And so we're going to have to take all the great advice you both just gave about not letting the job get in the way of your kids knowing you love them and that they're a priority. And at the same time, we're going to have to struggle. I don't have a quick, easy answer for that. I think it's just one of those things that depending on what your family resources are, you have to struggle with. Let me toss out an example and see if you all can react to this with some other ideas as well. When our church went virtual with COVID and developed the YouTube channel and the Hulu channel and the website and all of that, we also put in place children's church because we used to have Sunday school. And what as communities can we do to make sure there are resources? I don't know, maybe something like, I know watching the NBC Nightly News with Lester Holt, they started doing a segment for kids where you can go online and there's news for the kids. Is there, can you talk a little bit about any examples you know of folks in the community starting things, either a place for parents to learn or a place for kids to connect with each other so that we can do a little bit more of this interacting and giving spaces for us to observe what's happening with the children in our community?
So that's a real good point, Dr. Walks. And so, one of the things, of course, this whole situation, all this stuff has just impacted us, emotionally, psychologically, and so forth. One of the things that I did as part of helping myself and helping the community was I became a lifetime member of the NAACP. And then I now serve on the executive committee of the DeKalb County NAACP, which is, Atlanta is made up of, several big counties, and DeKalb County is one of our largest counties. It has, 1 million people that are mostly people of color. And so, one of the places that our community here in, we use the DeKalb County and NAACP as a kind of a place for resources that we have, we help people with housing, we help people with children's programs, we help people with, that screaming where the NAACP came into place with racial discrimination that we see just blatant in our face, just like Dr. Higgins and you guys brought up about, Black Supreme Court justice, female. Wow, golly. How hard is it to have a Black coach in the NFL when the NFL is all Black? So all these things are kind of right in our face. So one of the places that we have exposed to us is use the NAACP. Every single one of us has benefited from what the NAACP does. We should all become members, regardless of what political party it is. One party's going to say this, another party's going to say that. We got to make sure we do some things independent of that party that's going to take care of us and our people.
Amen. Amen. Dr. Neighbor Stevens, I feel like I've been just hogging this wonderful resource that we have with these folks today.
I didn't want you to feel like you were the third wheel. So hopefully you do not now feel like
Not at all. Never.
No, this has been a fabulous discussion, and we are very grateful that you all were able to lead us in this conversation. I'm happy to say that our programs are archived on YouTube in almost real time. Eventually, it will also be on our website. But since this is of such an urgent need, I would suggest if you want to go back to find a replay, to look at our YouTube page. There was another question about earlier on the impact of using the internet, and I know you've touched on it, but could you both comment on both the positive and the negatives of the screen time our children are being exposed to and experience, and how we can turn it into a positive and decrease the negative?
One thing we do know, related to the obesity epidemic, is that the American Academy of Pediatrics has some very succinct guidelines about what is recommended with screen time. Before the pandemic, of course, an hour a day, but because of what happened to the pandemic, now our screen time has increased with tutoring, homework, online learning. So that has kind of changed those other guidelines. But that thing about, the internet and so forth is that, things on Facebook, Instagram, we have to be very mindful of what our children are doing there, because their self-worth, as so many have referenced, is how many likes they got. And from the other standpoint, we know that there's been lots of shaming that goes on that impacts children, their emotional wellness, and we've seen a much higher rate of depression, suicide attempts, and suicide completion. So, we have to be very vigilant. And, it's like what Dr. Higgins said, it's not just quality, but it's quantity of time. You got to spend that time with your child, in the car, walking through the neighborhood, helping them with their homework, because many times it's during that time where you don't expect to hear something is when they tell you that.
Yeah, it's hard to share things with someone when they're not even a friend, so friendships are built with quantity of time. All right. And so also the issue is also the issue of technology and not understanding or having it. You know, too often, I know at least as a professional, you know, if my child is having some issue with the computer, well, chances are they're going to tell me about it. Well, they've got all the devices and all of those things. We got to be very concerned about some of the other issues that we found in the Black community with when it came to people not having computers. You know, I didn't. You had children actually trying to go to school off their phones, and then you've got 3 kids in the house trying to go to school off one phone. So I would tell people if you're having issues with technology, and I saw one of the questions, most school districts are giving out laptops. Most, the greater majority. So one thing that we found here in the city of Houston, which is mostly urban, mostly people of color, is that a lot of people didn't have laptops. We also found a lot of people didn't even have high-speed internet in the middle of the city. For some reason, it was the Black neighborhoods and the brown neighborhoods that didn't have high-speed internet. So we've got to make sure that we stay on top of that. I would say I would not cut off social media to your kid because right now they cannot, it's hard for them to contact anyone, but I would definitely monitor what's on there, but also as stated, have conversations. Listen, your life is not about who liked your last pic. And you've got to say that because sadly you see more provocative pics because they're trying to get more likes and things of that sort. But it's important to have conversations about what's online and you've got to be familiar. So even though I'm not a big TikTok fan, well, because I'm a child psychiatrist and because they're a kid in my home, well, they're young adult, she's a young adult now, I've got to understand how that media works. So I've got to get on there. I've got to form my own account on Snapchat to see what's going on there, whether I like it or not. So what you want to do is make sure that you're monitoring that information and discuss it. So if you heard a topic on the news about that, talk to your child about it. So you can get an understanding and you can help correct that because I'm gonna guarantee you this, no matter what the topic is, your child would prefer to hear it from you. So you've got to make sure that you're familiar with it.
So Dr. Griffith, Dr. Higgins, thank you both so much. I did want to go back to one of the things that we talked about earlier. We've talked about resources for young people. And one of the ones that was mentioned earlier was prayer. And I wanted to go back to that because it's, and I'm not going to quote scripture, and I don't get a chance to do this when I'm working as a psychiatrist. So let me do it now. You know, it is important for us to introduce our children to a relationship with, and I'm going to try to be politically correct and say something bigger than themselves. I know what that is for me. That's Christ and that's God. But in addition to meditating about it, praying with your children, and helping them to form their own relationship. It's a big deal when a child understands that they can pray directly. And one of the things that I think it's important to teach children to pray about, in addition to the asking for things that they may lack or asking for things for people they love, is thanking God for a place to go with the prayer. It's a big deal when things are heavy on us or weighing on us and we don't know where to take them. You know, take it to the Lord in prayer. If nobody ever taught you how to pray, it's harder to do that. And so I want to just make sure that as we're talking about young people and about resources for them, that we are, one of my favorite words, unashamedly, we are unashamedly able to talk to young people about the resource I have, because I have a place to go when things are bothering me. I know that God cares about me. And so when something is hurting me or challenging me, I can go someplace without asking anybody's permission. Maybe I don't want to tell somebody right now because I haven't put it together quite in my head how to tell somebody what's bothering me, but I can start because I've got an established relationship and it's just me and God, and we can work through that to some point. And hopefully in the middle of that, there is the tell your parent, tell your guardian, because the danger and I see Pastor Pointer on. Pastor Pointer, don't get mad at me. The danger that we run into is sometimes people think that if I'm praying about it and God hasn't fixed it, then I must be bad or something is wrong with me. And I think that we have to face that one head on. I know I'm rambling a little bit, but we have to face that one head on, because there are many different ways that God responds to the things that are challenging us. And we have to make sure that we get into this enough so people don't think that it's only I ask for it and I get it, or it's only prayer is all there is, because we haven't talked at all today about mental health medications, but medications can be hugely important. So for me, one of the most important things in my professional background, I used to sit on the American Psychiatric Association Board of Trustees, and a few of us went to meet with the Pope to get something from the Pope, and it was a papal edict that basically said it's okay to go see your shrink. We want you to pray, we want you to come to Mass, and it's okay to go see your shrink. And I think that if we miss any of the things that are resources for us in our community, we miss an opportunity to really comprehensively approach the problems that we have. So again, sorry for going on and on so long, but I just left church a couple hours ago, and I just think it's such an important part of my life. Sometimes I just got to just give it out there.
No, Dr. Walks, you're right on point that, you have to say it. You have to put these things out there, because, with mental health, it is not just about a pill. It's not just about, seeing a psychologist, but it is that whole encompassing of spirituality. And your faith is a big part of that spiritual component of helping you with your mental state. And you brought up so many points about, parents spending that time and teaching your child to pray and how to pray. And it made me just think about, I still say the prayers that my father taught me and my mother taught me as a little boy. There's modifications to it, but it's still that base and fundamental that I use and have built upon.
Amen.
We're getting close to the end, and I was hoping that we could go back. And Dr. Higgins, I saw that you were about to make a comment, so we will certainly circle back to you as well. But one of you brought up the term resilience earlier, and I was hoping that we could just kind of touch on that for just a moment before we end. And I'm thinking that part of the whole resilience development is for both parent and child to understand their history, because I know when I have been in situations that I found particularly difficult, I would think back to my grandmother's grandmother that I had the opportunity of knowing, who was a former slave. And if she could survive slavery and raise her two girls, then surely I could deal with anything that I'm dealing with in this time. So I do remember this is February and Black History Month, and we'll probably be hitting on this a lot the course of the month. But if the two of you could respond to this whole resilience and the role of understanding our history and the point that you wanted to make, Dr. Higgins, regarding faith in our lives.
Well, let me start with the faith in our lives, and then we'll get to the history and why that's so important. Well, understand that psychiatry, psych and iatry, like pediatrics, the iatry portion is the treatment of. Psych is, before we change it to mental health, was the spirit, the wind, the ghost. So understanding that psychiatry is the treatment of the spirit, the wind, the ghost of the individual. So understand that I could give you a medication, but very rarely does me giving you a pill treat the issue. That's a part of the issue, but it's not the full issue. So making sure that your child has an understanding of themselves, the understanding of God, and the purpose of the connection between their wind and spirit and that of the Creator. of God or Jesus or Allah or whatever they may consider that person to be. But then that's good to have that connection, but with that individual, so they know that their purpose and that they were made of God and there's God within them, and they have the power of God to change whatever situation that they're in. Now, understanding your history is extremely important, because if you don't, the world will tell you what you are. And that's a very dangerous thing for any Black child, for the world to be telling them what they are, especially when you listen to the music that is coming out. Now, it's not all the music that is being made, but the music that is coming out, the images that are put out there, what the news is saying about them. And, George Floyd, whoever becomes the next Black history moment as the Supreme Court, first Black female Supreme Court justice, you've got to put that information in them. And I could talk about that all day. I had my daughter ask me yesterday, Dad, can you tell me the family history again? From the white folk to the slaves to the Africans and all of that sort of, and it warmed my heart that she actually wanted to know. That's the first time she asked without me just running off at the mouth. She was like, well, you need to write that down because that's too much for me to understand at one time. But the fact is that we've got to educate our children inside of the home about who we are as Black people, our purpose. And in good book that I just read, that's been around since the late 50s, that I've been told for years I should have read, and I finally did, and I thought it was the best book, one of the best books I'd written on Black history, was the book called Before the Mayflower. That is something that I really believe, I wish I would have read it 20 years ago. But that is a very key book that talks our history in Africa and why we ended up over here. Part of the reason of how we ended up over here, and tells you of the African histories and all of that and how that applies to us today. So that's extremely important for our children to know their history and to know their family history and who these people were and what they did, because it lets them know who they are. And without that, the world will tell you that, I don't know, Megan Thee Stallion, Nicki Minaj, and then the Black people shooting people on television, and how Black women don't have merit, to become Supreme Court justices. Those are things that we have to challenge, but that has to be done inside the home, because we cannot think that the school is going to do that for us. And right now, they're actually making our history to be, some are trying to make our history illegal as we speak, which tells you even more so that history has to be taught in the home.
Amen.
So again, about the resilience is basically, that definition is when you experience some applied stressor, and then the ability to recover from that and then move on. And this is where, Dr. Brett Stevens, you talked about your grandmother, your great-grandmother, and the strength of who that woman continues to be in your life, that you have her is that building block. And unfortunately, because of health disparities, African-American children are much more likely to have one or no grandparents at all. It's even been more pronounced during this COVID epidemic. And so this becomes that time how we use the space that we're in. You find these pictures, you find whatever of these old family pictures, to write it down, to create a story, so that it becomes part of the legacy of who each of us are and who your children are, so that they can pass this on down the line. We've not been able to do that for the most part of the people. I was in high school, I went to a very elite private school. I remember I went to someone's house, and I went in there, and they had a family tree that went back to 1500. And I was like, wow, that's like pretty cool. And as I reflect on this, it was just more than pretty cool, because what that did for that young man growing up, he knew he was from somebody who was important, and that he had an obligation also to be important and do good things within that line. And that's what we each have to do for ourselves and our children, our family, and our great-grandchildren, so they know who each of us are, how we survive today, and the things that each of them did to change today for the lives of others and coming down the line. So that's one of those things that we can do as part of our resilience right now. is create that pathway for your children and your grandchildren to see, so they know who they are and where they're coming from and what they're going to do.
Dr.
Well
Walks,
said.
would you like to round us up and head us out?
I'm happy to, Dr. Neighbor Stevens. Let me say, as we are getting ready to close out today, this immediately started last week as we talked about mental health in general, and it led us to today to talk about our children, our young people, our future. And it's hard to talk about history and have it matter if you're not talking about the future, right? So we've talked about our children today, and just want to really thank so much you, Dr. Higgins, and you, Dr. Griffith, Dr. Bean, who joined us also today and spoke with us. This has been an important day. Dr. Neighbor Stevens, I'm going to ask you for your final comments, because those are my final comments. And then I'm going to see how much trouble I got in trying to be theological, because Reverend Pointer's on, and I'm going to ask him to close us out after you have your words, Dr. Neighbor Stevens.
Thank you, Dr. Walks. I am going to change the subject because I feel that we're going to have to address this as usual, and that's the common sense talk. And the reason I want to end on the common sense talk is because as I see and hear more and more pushed by the public to no longer want to be forced to wear a mask, of course, not to be forced to get vaccinated, it means that we have to take even more ownership of taking care of ourselves. So don't forget, get your N95 masks, which are now available here in Nashville. You can go to Kroger and get 3, and they're being distributed all over the country in stores and drugstores and at community health centers and other sites. Check your local resources. Get your vaccine if you haven't had it. Make sure you wear your mask, because if somebody's had COVID, the science has shown that they can still be shedding virus after the 5th day. So even though they have been given permission for whatever reason, and I won't say what, that they can now go re-enter society after having COVID, if they don't have the sense and the decency to put on a mask, you wear yours wherever you are, because you don't know what these people have.
Can I just jump in on that just for 1 second? You guys know I'm not the world's best scientist. So all those fancy numbers, sometimes I just want to get down to the nitty and the gritty of it, as Gladys Knight and the Pip said in that song. You gave us some statistics earlier. Let me just say what jumped out at me. I think the percentage of the population of the United States that's Black is that number, that percent number is higher than the percent of people who have been vaccinated that are Black. So we're losing on the vaccination side. And that number of the percentage of us in America that are Black is lower than the percentage of people who are Black that of all the people that died from COVID. So we're on the wrong side of both. We're on the wrong side of the percentage that are vaccinated, and we're on the wrong side of the percentage who have died. I just want to add that to the common sense argument, because you don't have to have any degree in mathematics to understand that we're on the wrong side. I'm gonna say it one last time. We're on the wrong side of the percentage of people who have been vaccinated, and we're on the wrong side of the percentage of people who have died from COVID. So yeah, common sense in protecting ourselves and our loved ones matters a huge amount. Thank you. Pastor Pointer, can we unmute? Maybe we shouldn't, because I think I'm in trouble. I think I went a little bit too far back into church this morning, Pastor Pointer, but can you please give us some final words and close us out today?
Walks, as usual, you're not on the mark. We're brothers. And so we can't afford to be taking each other to task when we can simply lovingly correct each other. So you're
Absolutely.
not in trouble. That would be mama and daddy, and I'm your brother, so you don't have to worry about that from me. As a matter of fact, I'm looking around to see if somebody's gonna pop me in the back of the head and straighten me up. So trust me, I need you to continue to walk alongside me as my brother. I think this has been a really rich conversation. And I think the most important thing we do as a community is pour into our young people what they simply don't know they don't know. And as smart as they are, they are not unlike we were. We had no idea who we were. You can look at me and see that I am in some way more than just the African roots of my ancestors that were held in chattel bondage. Some of them were violated, and I'm proof. And then even after we had come out of chattel bondage, we still lived in a Jim Crow South with all kinds of new erected laws and social policies that relegated us to a second-class citizenship, though we knew ourselves to be citizens of heaven. And even our uneducated, at least formally uneducated forebears knew that they walked down here on the earth, but they were not citizens here. They were citizens of another city, not made with human hands. They understood that. I think it's important for us to pass that to our children. I'm reminded, and I would recommend that if you haven't read it, every one of us should read the late Samuel DeWitt Proctor's The Substance of Things Hoped For, which is, of course, the personal history of Dr. Proctor's family and then of his life. But I think you will see yourself in it. And if you are not writing a book, you owe a book. So get to work. And let's make sure that our young people, in order to have good mental health, they need a foundation that speaks to how much they are valued and how deeply and completely they are loved. And so that is the task. It was done for us. And so let's make sure we're doing it for others. Having said all of that, no, you didn't get off track. I think though, but don't be afraid to wear your faith. You don't owe anybody anything. Tell people who you are and whose you are, and there's no crime committed. So let's give thanks this afternoon for this gathering. And look, I need all of you to listen carefully to Dr. Neighbor Stevens when she says, use common sense.
Amen.
When we didn't have degrees, we had common sense. So all of those letters that follow our name will mean nothing if we are lying on a funeral pyre this time next week, because we are out here acting like we're not still in a pandemic. We are. So please use the mitigations. We have known for 100+ years that masks work, that washing your hands works, that social distance works. And I love all of you. But when we're together, you be over there and I'll be over here, and I will love you just the same. So let's be careful. Let's be common sense wise, because that's what grandma and grandma taught. Grandma and granddad, that's what they taught us. So let's not lose sight of that. Let us pray. Holy God, Jacob's God, we thank you. First, oh God, that you are God all by yourself. But more particularly this afternoon, we thank you for your servants, Napoleon B. Higgins Jr., and M. Christopher Griffin, those medical doctors who you sent to sojourn with us this afternoon. So, oh God, here is our prayer. Oh God of creation, King of all creation, who has brought us to this hour, forgive us our sins, which we've committed this day in thought, word, and deed. Cleanse us, O Lord. Make us humble in our souls and in our persons, from every stain of flesh and spirit. Grant us, O Lord, to pass through the sleep of another night in peace, to rise from the place of a lowly bed, to please thy holy name, not only in the new day, but all of the days of our lives, and to vanquish the enemies, both bodily and spiritual, that contend against us. Deliver us, O Lord, from the vain thoughts that stain us, and from evil desires that hold us back. For thine is the kingdom and the power and the glory of the Father and of the Son and of the Holy Ghost, now and forever, and unto the age of ages. We're your children, and this is our prayer, O Lord. Amen, amen, amen.
Amen.
Be peaceful, love each other, do good, magnify his name.
Thank you, Pastor.
You're
And
quite welcome.
goodbye, everybody. See you next week.
Bye, everyone.
Good afternoon. God bless.